Many women know that they are pregnant at exactly 2 weeks, some others at 4 weeks, while others do not even know that they are pregnant at all until maybe during the late delivery. This is our focus today on sound health. We are looking at cryptic pregnancy. What exactly is cryptic pregnancy? And how do you go about it if you found yourself in this scenario or position? This is our focus today. Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. The conversation begins after this break. Please stay tuned.
The program is a 3-year program, and it involves training of health workers, providing mosquito nets and nutrients for malnourished children. We have also supplied equipment to primary health centers, as well as providing media information to the public. We believe that healthy mothers will produce healthy children, and our nation will also be healthy.
Malaria is a life-threatening disease which is preventable and treatable. We have various ways of preventing malaria. We have environmental sanitation, that is cleaning of our environment, clean gutters, then sleeping inside treated net 24/7, especially under 5 and pregnant women and aged. We have 2 types of malaria. We have uncomplicated malaria and severe malaria. Signs and symptoms of uncomplicated malaria: fever, headache, chills, general body aches. Then signs and symptoms of severe malaria: all those signs that I've mentioned with life-threatening, like severe convulsion, severe vomiting. Treatment of malaria starts with early diagnosis, appropriate treatment. Then we should have it in mind that not all fever is malaria until it is proved so. As soon as you are pregnant, you are already carrying 1 or 2 people inside you, and your immunity will be reducing. In prevention of malaria, you must sleep under treated net 24/7. And there's another drug that when your pregnancy is 13 weeks, you have to be taking it every 4 weeks until you deliver your baby. This is an insecticide treated net. If you collect it or you buy it, you have to spread it under a shelf for 24 hours. Then after that 24 hours, you have to hang it wherever you are sleeping, whether it is on the mat or on the bed. When you hang it, and you will sleep inside, not under, and you have to tuck it in. Then when you wake up in the morning, you will remove it and put it back. This one will act as a barrier for mosquito and other insects. Malaria is life-threatening disease. It is preventable and treatable. If you have malaria, you have to go to the hospital for diagnosis. Early diagnosis is the root cause of treatment.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening to look at cryptic pregnancy is Dr. Chukewmeka Odeigah. He is a consultant gynecologist and obstetrician with Iatros Specialist Hospital, and he is going to tell us all we need to know about cryptic pregnancy. Good evening, Dr. Odeigah, and thanks for joining us on the show again today.
Yeah, good evening.
All right, Dr. Odeigah, tell us what exactly is cryptic pregnancy?
Right. Cryptic pregnancy actually occurs in a situation where the woman is pregnant, but she's unaware of the pregnancy until late in the pregnancy or even when labor starts. And this uncommon condition may be as a result of few or absent pregnancy signs, things like bleeding instead of period, mild nausea, which may be attributed to illness or any other things, and also irregular periods, false pregnancy test results, especially home pregnancy tests, which are done. Okay.
All right. So is there a difference between cryptic pregnancy and ectopic pregnancy?
Oh yes, there's a difference. Cryptic means hidden. That's in layman's term. When you hear something is cryptic, it means it's hidden. Whereas when you hear something is an ectopic, it means it's not in the right place, or it's somewhere else but not in the right place. So in an ectopic pregnancy, usually the pregnancy is not within the normal uterine cavity that's inside the womb. The commonest site is actually in the fallopian tube, but may be found in other sites, maybe the ovaries, maybe the cornua, that's like the angles of the womb, maybe inside the abdomen itself. Okay, there is a pregnancy. The woman will be having symptoms of pregnancy, okay, but the pregnancy is not situated in the right position. That's an ectopic. Whereas with cryptic pregnancy, the woman, there's usually a pregnancy is in the right position inside the womb, but the woman is unaware that she's pregnant, sometimes until when she goes into labor.
All right. So how is this possible? Because it keeps, it keeps pricking my mind to ask you this question. How is it possible to be pregnant and you do not know? Because some people, as early as 2 weeks, spot on, they know that they are pregnant. But how can you just say you do not know that you're pregnant until maybe you're close to delivery? Why does this happen?
Yes. Well, as I said, a lot of times they may not experience symptoms or signs usually associated with pregnancy. So, for instance, they may be having intermittent spotting, okay, which they will now assume is their normal period during the pregnancy. Certain pregnancies you could have spotting early on, you can have a threatening miscarriage, later on, there are things like what is referred to as antepartum hemorrhage, so because of that, then for some of these women, they have lack of what they call the baby bump. There are some women that even when the pregnancy is very early, they have a large baby bump. But for some women, it may not be readily obvious even until when they go into labor. Okay, and then pregnancy symptoms may be very mild, things like nausea. A good number of women, especially first timers, in the first trimester, they may experience lots of nausea and vomiting, but you will have those women that will not have any of those symptoms at all, and therefore they will not know that they are pregnant. Some of the contributory factors include the presence of irregular periods even before getting pregnant. Okay, commonly a common cause of this in this our environment is polycystic ovary syndrome. Okay, where they could stay for months without having period naturally. Okay, use of birth control, because sometimes they may be on some form of birth control, which will make their periods to cease, or they could be skipping periods, maybe like the oral contraceptive pill or whatnot. Also, the placenta position. Sometimes the placenta, when it's in front of the baby, that one actually masks the woman feeling any fetal movements. So she will not perceive the fetal movements, which normally she ought to, from about 16 to 20 weeks of pregnancy. And of course, we talked about misinterpreted symptoms, nausea, weight changes, fatigue, and other things could be missed. And then psychological factors. It's been shown that in a lot of these women, they are suffering from some form of stress, denial, or mental health issues, okay, that can prevent recognition of pregnancy. And then, of course, false negative pregnancy tests, especially home tests. So these are the common causes.
Okay, are babies born this way? Are they healthy? What is their health status after delivery?
Well, there could be problems associated with the baby because these women have not received antenatal care, okay? And a lot of times, the delivery itself could be unassisted We had cases where the woman, maybe she went into the toilet and started having contractions, and then the baby came out, So risks even from injury to the baby during the process of delivery, and then because they not receive proper antenatal care, they are not on, the woman is not on folic acid, for instance, to prevent neural tube defects, the dietary advice which you will give the woman, she's probably not able to follow it. So the risk of abnormalities to the baby is higher, okay?
Can a medical ultrasound miss the sound of a fetus? When you're pregnant, when you go for antenatal, or even if you don't feel pregnant, or if you feel pregnant, if you go for this medical ultrasound, can the baby or the fetus be detected?
Yes, usually the fetus will be detected, okay? But another thing too depends on the timing of the scan, okay? We know fully well that if you do a scan quite early in pregnancy, usually before, let's say about, if you are doing an abdominal scan, let's say before about 5 to 6 weeks, we may not see the sac, okay, which surrounds the baby, which is usually the earliest sign of pregnancy, okay? So everything now depends on the timing, okay? Also, it depends on the skill of the person doing the scan, because these days we do have quacks, people, they may not even be medical people at all, and then they position themselves somewhere where they could be doing scans for collecting money and reporting different things, okay? Also, would also depend on the resolution of the scan machine. So if, for instance, the scan machine, the resolution is very, very poor, the man there will be imagining whatever he's seeing, and then will be giving false reports, So these are certain scenarios which could cause the person to miss a pregnancy.
Okay, so I know you mentioned it could be risky. Are there certain risks a physician must start processing before delivery dates? And in your years of experience, have you encountered where a woman with this kind of pregnancy visit the health facility and voila, the person is prepped to deliver in 2 days or immediately?
In literature, is quoted as happening in about 1 in 475 pregnancies. But of course, these figures are usually in the developed world. We probably don't have our own studies done here. In my own limited experience, I think I've only encountered cryptic pregnancy once, okay? And luckily, that particular woman, we picked it up when she was about 20. She was still in her second trimester, 20 something weeks or thereabout. So we quickly were able to refer her for antenatal care, and she received antenatal care and had an uneventful delivery. Both the mother and the baby were fine, So what I'm saying is that, yes, it's been reported to happen. How common it is in our environment is difficult to say. So, but generally, if we are able to pick it up, then at whatever stage, hopefully before the onset of labor, then is to continue with regular antenatal care, okay, and all the preventive measures that are usually carried out during antenatal care, such as health promotion and disease prevention with vaccinations and things like that, birth preparedness and complication readiness, things like that,
All right, so quickly, what should families, immediate families, should start doing for this kind of woman in this kind of condition or situation?
Well, if there's a suspicion, I think those closest to her, because you see, the thing is that in the hospital, the we are a lot of times the medical personnel in the hospital are not going to go out on the streets to start picking people who may have such conditions. Okay, preventive care a lot of times does not fall within the purview of the hospital personnel. Okay, so it has to be people in the in the grassroots, people that are around these women. So when people around them, maybe family members, um, those around the woman should notice symptoms or signs which could suggest pregnancy. And when this happen, they should urge the affected woman to present to a healthcare provider for proper testing, okay, evaluation, and when she's found, if and when she's found to actually be pregnant, should be offered quality antenatal care, emotional support, and a skilled birth attendant at delivery. We have to minimize lots of complications which have happened both to the mother and to the baby.
All right. Do women with hormonal imbalance are at risk than any other women?
Yes, when I was talking about some of the causes earlier, I mentioned irregular menstruation, irregular periods, and one of the most common causes of these irregular periods is something called polycystic ovary syndrome, which accounts for about 25% of cases of anovulation. That's where a woman is not ovulating. So the woman may either not be ovulating or she may not be ovulating frequently, and because of regularly rather, and because of this, the periods may be irregular. So she could stay for months without menses, and she would just assume that it's normal. She wouldn't even bother doing a pregnancy test, especially when she's not having any symptoms that could suggest pregnancy.
All right. Without the symptoms, that doesn't mean a lady cannot be pregnant if she's sexually active.
Yes.
All right. What advice do you have for such women when they visit the hospital and realize that they are pregnant? I know you have touched that already. Can you please re-emphasize this, that it is normal for you to be pregnant and not be informed or aware?
Well, if and when they discover they are actually pregnant, I'm sure first and foremost it will be a huge shock to them emotionally. So they will require emotional support. Some of these women may actually not be socially ready, the right group of women, let me use that language. They may not be ready for pregnancy, both financially and even the changes to their body, the health challenges or risks that may be associated with pregnancy. So they will require a lot of support. They require emotional support, even from a counselor, and all that, as well as the medical team in terms of offering them good antenatal care and having a skilled birth attendant at the delivery.
All right. Dr. Chukewmeka Odeigah, thank you so much for the clarification and enlightenment on cryptic pregnancy. We really appreciate your time.
Yes, thank you.
Sound Health continues with trending health report from around the world. Please stay tuned. program is still Sound Health on Lagos Television. Is it possible you are pregnant and you are not aware? It is possible. Anything is possible medically. You heard what Dr. Chukewmeka Odeigah said while on the show. But it's no problem if you're pregnant and you are not aware. So far or so long you have a good medical team on board to give you the necessary support. Visit the nearest health facility if you feel unwell or notice any symptoms early enough. This is why we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 003582603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.